Boy, he's just thrilled with that.
Requesting artillery on the 19 grid line.
Hello everyone. Welcome to the channel. Today we're talking about a topic that has affected the entire world, COVID-19. Whether you've experienced it personally, know someone who has, or are simply trying to understand the virus better, this video will provide you with the scientific and medical insights you need to know.
The SARS-CoV-2 virus, which is the source of COVID-19, has altered the way we communicate, live, and even think about health. Today, we'll dissect the symptoms and indicators and go over the most recent medical and scientific treatments available. In case you're new here, don't forget to hit the notification bell, like and subscribe for more science, health, and medical stuff.
When was coronavirus first discovered? In 1965, the first coronavirus to infect humans was identified. Coronaviruses can infect both humans and animals and cause respiratory illnesses. The virus can cause a simple cold or a more serious illness like pneumonia in people.
What was the first COVID-19 history?
Being a new coronavirus, the virus that causes COVID-19 had never infected people before. After the virus was identified in Wuhan, China, in 2019, it quickly spread throughout the world. In March 2020, the World Health Organization proclaimed it to be a pandemic.
Let's get started.
Coronavirus evolution. In 1965, researchers discovered the first human coronavirus. It brought on a regular cold. Subsequently, throughout that decade, scientists discovered a family of related viruses that infected humans and animals, naming them after the shape of a crown. Humans can contract 7 different coronaviruses. The strain responsible for SARS first appeared in southern China in 2002 and swiftly expanded to 28 other nations. By July 2003, there had been over 8,000 cases of infection and 774 fatalities. In 2004, a little epidemic accounted for just 4 additional occurrences. This coronavirus produces headaches, fever, and respiratory issues like coughing and dyspnea. 2012 saw the launch of MERS in Saudi Arabia. Nearly 2,500 incidents have almost exclusively involved residents of or visitors to the Middle East compared to SARS. This coronavirus is less contagious but more deadly, having killed 858 individuals. Similar respiratory symptoms can potentially result in kidney failure. Understanding COVID-19. It's critical to comprehend what COVID-19 is and how it spreads before delving into the symptoms, indicators, and available treatments. 1. The SARS-CoV-2 virus. SARS-CoV-2 is the virus that causes COVID-19. The coronavirus family, which this virus belongs to, is also the source of other illnesses like the common cold and MERS Middle East respiratory syndrome. Aerosols in contact with contaminated surfaces are 2 other ways that SARS-CoV-2 might spread. Respiratory droplets are the main way that it spreads. 2. How the virus infects. SARS-CoV-2 binds to cells in your respiratory system by its spike proteins after entering your body, usually through your mouth or nose. It mainly targets these cells' ACE2 receptors, which let the virus in and allows it to multiply. This results in a variety of symptoms, varying in severity based on your immune system's reaction and general state of health. Let's now discuss those symptoms and how they manifest over time. Signs and symptoms of COVID-19. The COVID-19 symptoms might differ greatly. While some people may develop life-threatening illnesses, others may not show any symptoms at all. Let's examine the most typical indications and manifestations. 1. Common symptoms. The most common symptoms of COVID-19 include fever, one of the earliest signs. Most people with COVID-19 experience a rise in body temperature as their immune system responds to the infection. Cough. A dry, persistent cough is one of the hallmark symptoms of the disease. Fatigue. Many people report feeling unusually tired or weak, even if their other symptoms are mild. Loss of taste and smell anosmia. This is a unique and distinguishing feature of COVID-19 compared to other respiratory viruses. 1. Respiratory symptoms. Since COVID-19 predominantly affects the respiratory system, many patients experience symptoms including breathing difficulties or shortness of breath, chest pain or tightness, sore throat. These symptoms are particularly risky because they could indicate that the infection has progressed into the lungs where pneumonia could appear. 2. Gastrointestinal symptoms. While COVID-19 is largely a respiratory illness, some people also experience gastrointestinal issues such as diarrhea, nausea or vomiting, stomach pain. These symptoms are less common but can still appear, especially in severe cases or with variants of concern. 4. Other symptoms. Some people also report muscle or joint pain, headache, skin rashes like COVID toes, reddish or purple discoloration in the toes. Progression of the disease. How then does the illness worsen with time? The severity of COVID-19 can vary from mild to severe or even serious. Let's dissect these stages. 1. Mild to moderate cases. The majority of COVID-19 cases have mild to moderate symptoms at first. This indicates that although you can treat your symptoms at home, you might have a fever, cough, and body aches. Most patients get better in 2 to 3 weeks without going to the hospital. 2. Severe cases. In severe cases, COVID-19 can cause pneumonia and significant lung inflammation. When this happens, patients may experience shortness of breath that worsens, a drop in oxygen levels. Severe cases often require hospitalization, where patients may need supplemental oxygen to help them breathe. 3. Critical cases. When COVID-19 is severe, it can cause acute respiratory distress syndrome (ARDS), a condition in which breathing becomes almost impossible without mechanical assistance due to lung inflammation. These patients frequently need intubation and mechanical ventilation, monitoring in the intensive care unit (ICU). Now, it's important to mention that some people, particularly those with underlying conditions, may be at higher risk for severe or critical illness. This includes individuals with conditions like diabetes, hypertension, heart disease, obesity. People over the age of 65 are also at higher risk. Post-COVID syndrome, long COVID. Some patients experience persistent COVID-19 symptoms even after the virus has left their body. This is commonly known as post-COVID or extended COVID syndrome.
1. What is long COVID?
Long COVID is a disease in which symptoms continue for several weeks or even months following the conclusion of the acute phase of the sickness. Research indicates that between 10 and 30% of COVID-19 patients may experience chronic symptoms. 2 symptoms of long COVID. People with long COVID may experience fatigue that doesn't go away, brain fog or difficulty concentrating, shortness of breath even after mild activity, chest pain or heart palpitations, joint pain, headaches.
3. Who gets long COVID?
It can affect people of all ages, including those who had moderate episodes, and the reason why some people acquire lengthy COVID and others don't is still unclear. Medical professionals and researchers are currently working to determine the best ways to treat long-term COVID-19. Programs for rehabilitation that include breathing techniques, physical therapy, and mental health assistance may be helpful in certain situations. Treatments for COVID-19. Let's now discuss COVID-19 treatment. Although there isn't a cure, a number of therapies can help control the symptoms, avert complications, and hasten healing. 1. Home care for mild cases. If you have a mild case of COVID-19, the main treatment involves supportive care at home. This includes rest. Your body needs time to fight the infection. Fluids. Staying hydrated is crucial, especially if you have a fever. Over-the-counter medications to manage fever, body aches, and cough. You can take medications like acetaminophen or ibuprofen. Consult a doctor before use. 2. Hospital treatments for severe cases. For more severe cases of COVID-19, hospitalization may be necessary. Some common treatments include oxygen therapy for people whose blood oxygen levels drop too low, dexamethasone, a corticosteroid that has been shown to reduce mortality in severe COVID-19 patients, antiviral medications like remdesivir. These help slow down the virus's replication, although they are most effective when used early in the disease. 3. Monoclonal antibody therapy. Monoclonal antibodies are synthetic molecules that mimic the immune system's ability to fight infections. Sometimes hospitalization can be avoided with early monoclonal antibody therapy, particularly in high-risk individuals. 4. Anti-inflammatory treatments. The immune system may go into overdrive and produce a cytokine storm when COVID-19 is severe. Physicians may employ anti-inflammatory therapies such as tocilizumab, a monoclonal antibody that targets an inflammatory protein called IL-6. 5. Ventilation and ICU care. In severe situations where breathing becomes too challenging, mechanical ventilation could be necessary. In order to assist patients in breathing while their lungs heal, ventilators are used. In severe situations, an equipment called an extracorporeal membrane oxygenator (ECMO) may be utilized to momentarily replace lung function.
COVID-19 vaccines and prevention.
Lastly, one of the most important tools we have in fighting COVID-19 is vaccination. 1. COVID-19 vaccines. Numerous vaccinations, including the Johnson & Johnson, Moderna, and Pfizer BioNTech vaccines, have been created to guard against COVID-19. Your immune system is trained by these vaccines to identify and combat the virus. Vaccines have been shown to reduce the risk of severe disease, hospitalization, and death, prevent infection to some extent, though breakthrough cases can still occur. 2. Booster shots. For some people, booster doses are advised to maintain protection as the virus mutates and new types appear. 3. Public health measures.
Public health initiatives including mask use, social distance, and hand cleanliness continue to be crucial instruments in the fight against COVID-19 transmission in addition to vaccinations. Although COVID-19 has been a difficult and frequently fatal worldwide health emergency, we can still protect ourselves and those around us if we have the correct information and resources. We all have a part to play, whether it is through immunization, adhering to public health policies, or just remaining educated.
Appreciate you seeing the video for today. We hope this information was helpful to you. If so, kindly like, comment, and subscribe to our channel in order to receive more advice and insights about health. Please leave a comment below if you have any queries or suggestions for topics we should
Subscribe to my channel.